Welcome to Your Health. I'm your host, Rhonda Alfred, and on this episode, I'm joined by Jaime Gaudet, nurse practitioner at Gulf Coast Orthopedics and Terrebonne General Health System. Today, we're going to be talking about orthopedics. Welcome to the show, Jaime.
Thanks, Rhonda. Thanks for having me.
All right, we're so happy to have you on.
Thank you.
Your wealth of knowledge.
Yes, happy to share.
Well, good. Well, tell us a little bit about yourself and your role at Terrebonne General and Gulf Coast.
Perfect. So I'm a nurse practitioner at Gulf Coast. I've been there a little over 10 years with the practice. I have a clinical aspect, but I also get to be involved in leadership at the practice, which is exciting because I get to take care of my patients, but also get to help take care of the staff. And that's really enjoyable for me, very fulfilling.
Good, good. All right, let's get started with just talking about what type of ailments do orthopedics treat?
Well, orthopedics in general, our specialty deals with musculoskeletal systems. So that's a fancy way of saying muscles, bones, joints, tendons, ligaments, all the things that help support the skeletal structure. So variety, any given day, we can see trauma, which we think fractures, that's the big thing, ACL problems, sprains and strains. Sometimes it's just over time we get blessed with things like arthritis, low back pain, carpal tunnel syndrome, right? It's not really from an injury, but it's more from a trauma. So we see those things in any given day, multiple times a day, which is good because with repetition, you get really good at treating it. So you get people better quickly and they can get back to doing the things they love to do. But that's orthopedics in general, yeah.
Okay. And what patient population do you treat?
So children, young children, all the way to very mature adults, across the lifespan, really. I think for me, personally, I love the sports medicine aspect of our practice. So I love treating our student athletes. We have a real passion, not just me, but at the clinic, of seeing those athletes doing what they do. Perhaps they get injured or just have an overuse injury, and we can treat them and get them back to doing what they do and see them back on the court or the field. That's really, really empowering for them and for us. But we treat everybody from little bitty kiddos all the way up to very mature adults.
Wide gamut there. Okay, so when should someone seek orthopedic help?
Okay, that's a great question, Rhonda. So I would say this. There'll be times in your life where you'll have a bump and a bruise, and you might have an ooh-yi-yi, as we say down here. If that doesn't get better with time, or if it worsens rapidly, it's probably going to be in your best interest to give somebody a call and let us check you out. Go see somebody who specializes in orthopedics to make sure this isn't something that needs a more invasive treatment than you can do over the counter or at home. But most of the time, people call me and tell me they fell or they got a little ooh-yi-yi. I tell them, ice it, elevate it, rest it for a bit. But if it doesn't get better or if it gets worse, it's going to be in your best interest to get it checked out.
Okay, better safe than sorry.
Every time, every time. Yeah.
Every time. What kind of orthopedic complaints do you get most often?
Top 5, okay. Back pain, for sure. Foot pain, for sure. Joints, shoulders, hips, knees, hand pain, you get a lot of arthritis in your thumbs and carpal tunnel syndrome. We see a lot of that. But I think the more incapacitating ones are the ones of those load-bearing joints, the backs, the hips, the knees, the feet. Those are the ones that people come in and they need relief. They're uncomfortable and it's really affecting their ability in their daily life. So I think those are the ones that I think are the most common and most significant when they come in.
Okay, what about knee pain? What type of treatment options do you offer for that?
Okay, so it depends on what kind of pain you're having. If it's the result of a trauma, like a fracture, ACL rupture, we have very definitive treatment, and it usually involves some type of surgical intervention. If it's a pain that you've been given over time, like arthritis, there's a wide range, from very little. When I see my patients, I said, okay, here's a buffet. We can do nothing. You can do over-the-counter stuff. Maybe we'll do some topical or some prescription medicines. Maybe we'll do some injections. And then ultimately, if the pain is so severe and it's affecting their life, we'll talk about joint replacement. And if it's an ACL, rupture in an athlete that wants to get back, or a fracture, usually we go right to those definitive treatments so they can get better faster. They can get on the road to recovery. But it's real exciting because there's so many advances going on all the time that the way we treat it can vary from patient to patient. And over the past few years, there's been a lot of advancements. It's really exciting.
So they have a lot of options. Okay, quickly, tell us about the recovery period.
So now the most significant thing, quickly, because you said quickly, I think is most significant. In the world of total joints, our patients are going home the same day or just one night in the hospital. That's crazy better than what it was when I first started. We were here for weeks, or at least a week, right? And then when most of our outpatient surgeries, our patients go home the same day. They're starting their therapy, their recovery very, very early. So they're back to doing what they want to do quickly. And that's the take. The treatment options vary, but the way that we are treating and getting people back to doing what they want to do, it's fantastic. Really, really.
And that's the goal, really. Okay, 2 things you want people to know most about orthopedics.
Okay. We're here to help you, and it's not only when you have an awful problem. Don't suffer with pain from an orthopedic standpoint, musculoskeletal standpoint. You don't have to suffer. A lot of times we have treatment options that are non-invasive, easy to implement in your life, and it can give you quality. So you don't have to wait till you can't walk anymore to come see us. Come early, let us help you, let us share our knowledge with you. It's what we're here for. That's be the big thing.
Okay, great. Well, thank you so much
You're
for sharing.
welcome.
And please come back and share some more.
I'd be happy to. Thanks
right.
so much, Rhonda.
You're welcome. Thanks for all you're doing, Jamie.
You're welcome.
For more information on orthopedic services at Terrebonne General Health System, visit tghealthsystem.com. That's all for To Your Health today. We'll see you right back here next week.